What's up everyone, if you are new, my name is Satyam kashyap. Today I am talking about diabetes mellitus. The people with diabetes are increasing day by day because of population growth, aging, urbanization and increased prevalence of obesity and physical inactivity. The prevalence of diabetes for all age groups worldwide was estimated to be 2.8% in 2000 and 4.4% in 2030. The total number of people with diabetes is projected to be 171 million in 2000 and 366 million in 2030. The prevalence of diabetes is more in men than women, but there are more women with diabetes than men. Since the diabetes is mainly a disease of older age groups and population is aging. Diabetes mellitus is not a disease, but includes a variety of disorders of metabolism, having an increase in blood sugar level and also usually accompanied by glycosuria. In most of these, there is also a greater or lesser tendency to ketosis, which is most important immediate risk, and also there is increased liability to vascular degeneration, which are long term most serious risks. Now, etiology of diabetes mellitus. Two factors of importance have been recognized. Number one, inherited tendency, and number two, overnutrition. There are two evidence for inherited tendency. Firstly, the history of diabetes in one or more blood relatives is common in diabetics than non-diabetics. Secondly, concordance means both twins developing diabetics. It is common in identical twins as well as in fraternal twins. The importance of overnutrition is shown by fact that over the age of 40, some 80% of the patient developing diabetes are or have been considerably overweight. Broadly speaking, both the incidence and mortality of diabetes above middle age vary with the degree of obesity. It appears likely that when inherited tendency is strong enough, the subject develops diabetes in early childhood and youth without becoming fat. But when inherited tendency is less strong, the disease manifests only when precipitating factor brings out the inherited predisposition. These conditions are obesity and pregnancy. The disease is more common in urban than in rural communities and in Jews than Gentiles. These differences may be due to habits such as regards in diet and physical exercise. Now, pathology. There are three main theories of the action of the insulin. Number one, that it is necessary for the utilization of the glucose in the cells. It is periphery underutilization of the glucose theory. Number second, that it prevents the overproduction of the glucose in liver. It is central overproduction of glucose theory. Number third, that it facilitates the transport of glucose and other substance across the cell membrane. It is impaired cell membrane permeability theory. All evidence suggests that third one is most important, having facilitate transport across the cell membrane. Insulin is formed in the beta cells of islets of Langerhans and released from those cells when the concentration of glucose rises in the pancreatic artery. One theory suggests that excessive secretion of diabetogenic hormone from anterior pituitary, that is growth hormone or very similar like it, leads to exhaustion of beta cells. From the pancreas, insulin passes to the portal vein and finally to the liver. From there, it is split into A and B chains by insulinase and some is conjugated with protein. From the liver, it passes to general circulation where it exposed to various antagonists and anti-insulin factors. It includes pituitary and cortical hormones and other antagonists. One of them associated with the albumin fraction of the plasma protein. Valence ovum was much studied that it present at the lower level in the normal person plasma protein and it present at the higher level in all idiopathic diabetics. Valence ovum has produced results that this thin albumin is the V chain of the insulin that is attached to the plasma albumin. This work suggests that the presence of syn-albumin antagonist in the axis is the etiological factor of all idiopathic diabetics, that is inherited. Now, from the general circulation, insulin has reached to the cells. Now, the clinical picture of the patient. The classical onset with severe thirst, polyuria and weight loss is seen in the minority, perhaps the one-third of the cases. Lack of energy, muscular weakness, mild thirst and some loss of weight is seen in the another one-third if inquiry is made about them. Constipation from dehydration is occasionally a persisting symptom. Real loss of weight with increased appetite means either thyrotoxicosis or diabetes mellitus. It may be said that all diabetics fall into one of two groups. The older and fatter tend to have mild symptoms with insidious onset, more often present with an complication, have little tendency to ketosis and are insensitive to insulin. These are called maturity onset type. The younger and thinner more often have severe and classical symptoms with definitive onset, are very liable to ketosis and are sensitive to insulin. They are called juvenile onset type. In older diabetics, sometimes develop a juvenile type and may develop ketosis. A few patients are virtually symptomless. The glycosuria is being discovered when the urine is examined as a routine for the life insurance or other purposes, and physical examination shows nothing in mild uncomplicated diabetes. In severe cases, there may be weakness and fasting with some degree of dehydration. In more severe cases, the dry brownish tongue, the odor of the acetone in the breath, and an enlarged tender liver may indicate that the patient is in impending coma. Now, the diagnosis. Diagnosis is made up by urine testing, blood sugar and glucose tolerance test. In urine testing, the positive result shows that there is any reducing substance in the urine, but not that substance is glucose. The false positives may be due to drugs such as aspirin, salicylates, chloral hydrate and ascorbic acid or presence of other sugars. Now, the blood sugar and glucose tolerance test. The clinically diagnosis of the diabetes mellitus can be confirmed by estimating single blood sugar 1.5 hours after the meal, at least containing 50 gram of carbohydrate. If this is above 180 mg%, the diagnosis is confirmed. Whether to treat a patient with diet alone or with insulin depend on the severity of the symptoms, presence and absence of the complications and the patient's weight and the age, and not on the results of the investigations such as glucose tolerance test. Homeopathy can also control the diabetes. If there is any doubt, patient should consult the physician. Friends, don't forget to hit the subscribe button and be the part of the YouTube family. Good day.